So part 6 is all about the economics of rationing. Now, the NHS is quite rightly free at the point of contact, but different health services cost different amounts of money. So a GP appointment is about £38. A&E attendance varies, but about £160. So it's big changes in cost. But how we ration services seems to actually bear no link to those costs. So there are two main ways in which health services are rationed. The first is through waiting lists and waiting times. So if you want to go and see a doctor, the current waiting list at my surgery is about 2 weeks. It's quite difficult to get an appointment. I live in London. If I want to go to A&E, for now, the target is 4 hours. So actually, on balance, if I've got 4 hours, I'm probably just going to go down to A&E. But the costs of that are 3 times as great as if I went to a GP surgery. So there's an inherent structural problem in terms of how we ration services in comparison to how much they cost. The second and main form of rationing then is also needs-based rationing. Now again, you have to have thresholds for services. You can't just open them to everyone. However, we have very different ways of rationing depending on how much services cost. So if you want to go to a CMHT and get a service there, you're going to have a very significant and lengthy assessment that they're going to give you to make sure that you fit the bill. The police, ambulance and fire brigade, on the other hand, they're just going to come when you call them. There is no threshold, they're just going to come along. But the costs of those services are a lot higher than it is to get a community service placement. And again, it's this issue of we need to look at how we ration services so that yes, they respond to need and they respond to the demands of the public, but also that they reflect the cost of what they are. Because actually if we did that, we could save a lot of money and probably get a lot better outcomes for the people that need help. So what's the solution to that? Well, there are two ways I think it can be done. The first is a stringent assessment of actual need. So your emergency services are fantastic because they are free at the point of contact and they are going to come immediately. And they are your bellwether. They tell you exactly what the level of demand is because they are unconstrained to some extent. And the second thing is we have to have an understanding and an acceptance that we are objectively currently with our system funneling people towards expensive services. The solution to that, therefore, is to look again at how you provide other services at different points in the system which are earlier and preventive in order to A, meet people at a better point when things can be resolved faster, but B, in a more cost-effective value for money way. So that, I think, is the solution.